Hello, everyone. My name is Dr. Rekon from Howard University Hospital Internal Medicine. I'm excited to share with you this quality improvement project we did in our ICU with ICU Delirium. And the background to this study was that we realized that most nurses and physicians lack the knowledge in ICU Delirium and even how to assess it and also how to manage it. And so we did a survey in a hospital among the residents and among the nurses. We realized that most of us did not know about ICU delirium. And so what we wanted to do by way of improvement is to educate our nurses to improve their knowledge in ICU delirium and also how to use the validated screening tools, which is the confusion assessment method in ICU. And so we had an 1 hour in-person training session for the nurses where we did a pre and a post test just to assess the impact of the interventions that was being done. And then we realized that for the pre-test, most of the nurses, the average score was 2.9/10. And then when we did the post-test, averagely the score was 7.2. And so when we analyzed it, we realized that there was a statistical difference, kind of like in the pre and post test, and which goes to say that if people are educated on a particular subject, and in this case, if people are educated in ICU delirium, then their knowledge is going to improve, which is going to translate in how they manage the patient, and then also how they can diagnose and then promptly manage the patient for an improved outcome. And so, and what I want to say is that ICU delirium is real, and most of us really didn't know much about it. But if we would put in, the work at educating our nurses, educating our physicians, then what is going to happen is that we will gain more knowledge, more understanding. We'll gain knowledge as to how we can assess. We should assess it, and we'll also promptly diagnose it and then manage it in time to prevent all these deleterious effects that the patients do suffer when they have ICU delirium. I hope this quality improvement will inspire you to also replicate the same thing in your facility to improve care. Thank you very much.